Good morning, good afternoon, good evening, everyone. My name is Olivier Defawe. I'm a director in the health system program at VillageReach, and I'm pleased to be your host today. And I will be joined by a speaker who is going to talk about how logistic management information system that is being used in many different countries called OpenLMIS has been adapted to be able to respond to the COVID-19 pandemic. And we will be joined by Wes Brown. So Wes Brown is a senior technical manager at VillageReach, a colleague of mine, and has been involved with OpenLMIS since 2018, most recently as a technical product manager, the technical OpenLMIS product manager. Wes lives in Nairobi, and he focuses his attention on the utilization of technology to empower health practitioners. So without further ado, Wes, the floor is yours.
Thanks, Olivier. So yes, today we were going to be talking about how OpenLMIS is being adapted to respond to the COVID pandemic and how we as an organization and as a project are trying to respond to supporting supply chains within the COVID pandemic. So as Olivier mentioned, my name is Wesley Brown. I'm a senior technical manager with VillageReach and also the product manager or technical product manager at OpenLMIS. I'm based in Nairobi, and you can see my email there. So if you have any questions coming out of this presentation, please feel free to reach out to me. So this presentation, I wanted to spend a little bit of time just talking about what OpenLMIS is, what it does, where it's being used, and then also getting into how it's being adapted for use in the COVID pandemic, some of the lessons that we've learned from it, and then conclude. So to start here, I just wanted to share, this is the mission statement for OpenLMIS. We want to collaboratively develop shared open source software to improve health commodity distribution in low and middle income countries, or LMICs. So with that mission statement, what does OpenLMIS actually do? So OpenLMIS is an open source logistics management information system, LMIS, so OpenLMIS. And it's been designed for those LMICs. And really core to what it does is that it's really highly configurable, because the intention is that it can be used as a core system across many different contexts, many different countries, maybe other different scenarios as well. With the same core, so that everybody can benefit from the work that each individual implementation is doing. In terms of like what it actually does is it helps healthcare workers to easily track and order new commodities, keep track of what stock they have on hand, and then also saves them time as they are doing their what we call the requisitioning process. That's the process of requesting new commodities at a facility. So automating that as much as possible so that the calculations that are done are automatic, and that that whole process, instead of being run on paper and having to flow up through countries very slowly that way, it can be done electronically and is auditable, and we can get reports from it, all those kind of things. And in the countries that it's been used, there has been a proven ability to reduce overall stockouts at facilities and greatly increase the overall reporting of stock data. So we're pretty happy with the uptake of it and how it's been able to actually help contribute towards its overall mission. We have a pretty robust partner network, and we have three categories that we like to think about. We have the donors there at the top, the implementing partners. These are the groups that help to design OpenLMIS and steward it going forward. And then the technology partners there at the bottom, who actually do a lot of the technical work itself. The organization that I'm a part of, VillageReach, is one of the key implementing partners in that we have been stewarding OpenLMIS since this version got going more than 5 years ago. So OpenLMIS has had a key role in taking OpenLMIS to where it is now, along with these other partners, of course. But this is the reason that I have a dual role with OpenLMIS and VillageReach is because VillageReach is the overall steward of OpenLMIS. So on to what the core features of OpenLMIS are. And if you look on the left-hand side here, we see that the requisitions, order fulfillment, and stock or inventory management, that is the core of OpenLMIS. That's the main functionality that it has. Like I said before, requisitions is simply just the ability to request new commodities, so new drugs, new products on a regular basis. Oftentimes it's monthly, it could be quarterly. The system will support pretty much any interval that you want. But that's the core process. And it sounds like a simple process, but it's really not. Especially for medical commodities, especially in the countries that we're working in, there tends to be a fairly deep supply chain that's associated with that. So there may be different levels of approval, and those approval levels may be different by program. A program being something like a malaria program or a TB program or HIV/AIDS program. And so the system it needs to be able to support a flexible structure for that. And then once a requisition is approved, it needs to be converted to an order so that a warehouse or a central medical store can actually send a package to the facility that needs those commodities. And then once that package is received, then the system needs to track that, here's what was actually received, here's what was sent. Is there any discrepancy? If so, can you explain what happened? And lastly, the thing that ties all of this together is the stock management piece. So this is something that facilities always want because it helps them to be able to keep track of what they have on hand, which is a pain to do when you're doing it in paper. There's obviously lots of places that do it, but it's a really time-consuming and it's a very detail-oriented, difficult task to do well. The system helps with that and then takes that same stock information and has it flow back into the requisition that you do in the next month so that you don't have to enter how much consumption you had when you're doing your requisition. The system already knows that. So then on the right-hand side, the features are more secondary in that they build on top of the core features. Obviously, the analytics and reporting piece is very important. It's kind of the positive that you get after doing all the work of entering the data in for requisitions and inventory management, because now you have the ability to look at a whole country or a specific region to be able to get an idea for what's going on. If, where we're seeing stockouts in District A, why are we seeing that? You can drill down into the demographic, geographic data to figure out, okay, is this specific area having a problem? Maybe there's a road outage. Maybe there's been a lot more consumption or a spike in those specific commodity, the consumption of those specific commodities for some reason. Anyways, the analytics and reporting engine allows you to be able to slice and dice your data to be able to answer those kind of questions. And then I'll also mention the equipment piece here because it has direct applicability here to the COVID work that we've been doing, in that it allows you to be able to track not only where equipment is, for example, where ventilators are located at facilities, but also keep track of a maintenance history of those devices and see the functional status of them. And then as we move into the vaccine stage of this pandemic, which we hope we move into soon, the cold chain equipment piece is going to become vitally important. So knowing that there's a refrigerator here or a freezer here and it's functional. And we also have an integration with a real-time temperature monitoring service created by a service called NextLeaf that will actually give you information to say that this refrigerator has been having problems. For example, the temperature has spiked 3 times in the last week. So you may want to send your temperature sensitive vaccines through that facility. As I mentioned before, OpenLMIS is highly configurable. We can support one program, we can support many programs. Once again, a program would be something like the TB and the commodities related to that, or essential medicines and all those different commodities related to that. The system can support one or many of them. And then for each one of those programs, you can have a highly different number of levels or number of gates in terms of the process that you use to request new things. You could have, as you see here, you could have many where you have a facility flowing up to a district, up to a region, and then up to the national level, or you could just have 2. I won't go through each one of these, but I just want to note that, that the system is intended to be very, very flexible. And the reason for that is that it's used in a wide variety of settings. You can see here, this is the countries right now that are using OpenLMIS currently. You can see it's all sub-Saharan Africa, and we've highlighted here also Cameroon, which is the current instance of the COVID edition that we'll be talking about in just a moment. So each one of these countries is similar in some ways, but those of you who have been to Africa know that it is not a monolithic block at all. Each one of these countries has their own difficulties that they have to deal with and their own strengths as well. And so our system has to be flexible to be able to deal with how each Ministry of Health decides to deal with the geographies that they have and the structures that they've put in place and the way that they've decided to distribute their medical commodities. Another piece that we always have to deal with, and so I just want to mention it briefly here, is interoperability. Once again, each one of those countries that we were just showing has their own health information architecture, their own health information systems that they're using, and most of them are somewhat different. There may be some common ones like DHIS2, but most countries will have different warehouse management systems, may even have multiple. They may have an electronic medical record system or none, but each country has their own specific requirements. And so the way that we handle interoperability is by not trying to build specific connections to individual systems. So like not building a connection from OpenLMIS to Epicor, for example. We would much rather be able to build on top of more generalized platforms that enable that. Things like OpenHIE or other HIMs, so health information mediators, that allow us to do that and be able to share that kind of work with any system that might handle that kind of functionality. That allows us to utilize standards and to be able to share that work so that we don't just build individual connections to individual things, but that we build connections to specific problem sets or feature sets. So at a high level then, here are some of the benefits of OpenLMIS. From the end user perspective, it saves them time, it gives them better quality data, and it makes it easy for them to look at reports that they have access to. At the system level, we have stock management, which is something that facilities always are interested in, as well as the managers that sit above those facilities. It's really helpful for them to be able to have accessibility into that. And I'll specifically highlight here that we do have a vaccine module that is specifically tailored to be able to handle the fact that vaccines oftentimes require some kind of temperature management. And so that's built into the system as well. So let's get on to the COVID information here. So when the COVID pandemic was breaking out, VillageReach alongside CHI saw that OpenLMIS would have a great opportunity to be able to help countries to be able to manage the various commodities. So the various, medical commodities or the various, PPE equipment, those kind of things that they would need to manage. And so we very quickly came up with an idea of putting a version of OpenLMIS together that would allow us to facilitate those COVID-19 supply chains and allow countries to very easily be able to utilize OpenLMIS with very little cost and very little training, things like that. So what we did was we created a very customized, well, excuse me, not a very customized, a very streamlined version of OpenLMIS so that we can reduce the amount of training. We can make it very easy for users to know what to do and how to do it. And we put a fair amount of work into figuring out exactly what is the product catalog that we should be using for this. The product catalog would be the different COVID-related commodities that we need to manage. We worked alongside the WHO and representatives at the UN to try to consume the product catalogs that they had put together and then mesh those with some of the countries that we were talking about. We offered this as a SaaS solution, so software as a service. It's sitting up in the cloud. It's easy for us to spin up a new instance and get it up and running. It's easy for a country because they don't need to try to procure a bunch of hardware and get it set up in some local data center. They can just say that they have an interest in using it, and we figure out the specifics of where to do that. And it's provided free of charge for a period of time, thanks to some of the donors that the Clinton Health Access Initiatives has. So this is something that we worked really hard on. We were really happy to get the feedback that we got from the countries that we've been working with. Like I said, we have one country right now, Cameroon, that's using it actively, but there are some others that are in various stages of interest. So here's some of the main features that we were really trying to target when we were thinking about COVID in the supply chain. Inventory management is a key one, obviously. Being able to see what do you have on hand at each facility to know maybe you need to be sending more than you expect in a specific district. Maybe you're seeing a spike happening in a specific area. First of all, that you can utilize the inventory data to be able to track that. I'm sure that hopefully you have other systems doing that as well. But you can respond to those kind of things very quickly rather than having to wait for an emergency call to say, I'm out of all of my PPE. I can't provide services right now. You can try to prevent those kind of shortages from happening. We also have streamlined that requisitioning process so that it's as easy as possible for the countries to set up the approval processes that they need to show you their due diligence while still getting the required commodities out as quickly as possible. We also have the equipment tracking piece that I mentioned earlier. Specifically, we're focusing here on ventilators. Being able to know where they are, the functional status of them has been really important. In Cameroon, it's something that we were happy to be able to provide with relatively little changes. And then the data visualization piece that I mentioned before in terms of being able to look at what's going on in your country with some easy to parse and easy to understand graphs has been really helpful as well. I'll show some examples of those in just a moment. Unfortunately, in this demo, there was not, or excuse me, in this presentation, there was not time to do a demo. So I did just want to show a couple of screenshots of the software. And that is not the right window. Yes, so let's start here with the requisition service. So this is showing the requisition page of OpenLMIS. We can see here at the top, we can see that we're working with a specific facility for a specific reporting period. And then in the second half of this page, we can see here our list of products. These are called full supply products. These are just simply the products that OpenLMIS expects you to always need. So like these might be your essential medicines, they might be, whatever the critical commodities that you would want to deal with. And this is coming from actually a screenshot of our demo system. So we can see this isn't specifically COVID related, but each one of these products can be specifically defined so that you can say these are the products that are full supply products versus the other imaginably named non-full supply products, which are those that can be optionally included in the requisition. So you can add those in as well. A couple of things that I'll highlight here is that we can see there's different types of order calculation that OpenLMIS supports out of the box. One is based on an ideal stock amount, where you just put a hard-coded value for a specific product. And the other is a bit more intelligent, and that utilizes average monthly consumption to be able to calculate an order for you. In either case, you can use that as a user of this and just enter that value in rather than having to spend a bunch of time trying to figure it out. So that's the requisition piece. The next one is a stock management service. So this is the physical inventory page. Another name for this might be a stock take page. This just lists at a specific facility what it thinks you actually have on hand. So we can see here in the first line item, it thinks that we have 78 of this Acme safety box. And I actually do have 78, so I typed that in there. But on the next line, it thinks that I have 45 of that syringe, but I only have 40. And so I've said, okay, I've lost the other 5. So I can see then at that final column that the unaccounted quantity is still 0. The other thing I'll highlight on this page is that OpenLMIS does have support for multiple lot codes and expiration dates for a given product, which we can see for that Intervax BCG. Yeah, that is critical then for the vaccine management, which is that other piece that we really hope is going to be something that is needed soon. Here is a screenshot of our reporting dashboard. Well, one of the reporting dashboards we have. This is the stock statics. We weren't able to show COVID-related data. We weren't able to show that publicly. So this is just using some demo data, but it does give you an idea of the kind of reports that you can see. We can see the stock out rate over time there in the top. We can see then for specific programs at the bottom, we have HIV stock levels, we have TB stock levels. And what those bar graphs are showing is whether or not you're adequately staffed, which is the purple ones, which are good, or you're understocked or overstocked. The system that we use is a system called Apache Superset for these reports. And that has proven to be really powerful. We have the ability to show lots of different kinds of visualizations. Here's just an example over here on the right of some of the kinds. You can see you can have maps, you can have advanced kind of volumetric reports, as well as, of course, the basic kind that you would expect to see in terms of pie charts, bar charts, histograms, those kind of things. The built-in reports that we always include with OpenLMIS and that are included for this COVID edition as well are the stockouts reports, which is obviously very important. Stock status, which is the one we were just looking at, consumption reports, orders, and then reporting rate and timeliness. So some of the lessons learned here as we wrap up. I think I mentioned this a little bit before, but one of the key pieces that we found that was really difficult and really important to get started early was in the definition of the product catalog. Even though we were starting from the product catalogs that had been defined by the WHO and the UN, Each country has their own, and finding commonality between those always proved to be difficult. So it's something that we had to start early, and something that is always a challenge. So if you're dealing with product-related data, this is something you need to get started early. The second is that even if the technology is ready, the country may not be. So as I mentioned before, we're in one country right now actively using the software, and there's others that we're in various stages of implementation. And a lot of that, the delay in that is just because we needed to make sure we had everything in the country ready for us to be able to do that. Which brings us up to the third point, and that is that whenever possible, you want to use a local partner. We have been lucky to be able to utilize CHI, and CHI has many different country teams. CHI is the Clinton Health Access Initiative again. And so without their support, we would not have been able to get to where we are. And the last thing that I want to mention here is that when a vaccine is available, the tracking of the allocation and the usage of those vaccines will be critical, as will the monitoring of the cold chain equipment. This is something that we know OpenLMIS has put a lot of time into being able to support well, and something that we really wanted to make sure we had in place for when we hope that vaccine becomes available in the near future. With that, I think that's it. Thank you so much for taking the time to learn a little bit about OpenLMIS and how we're trying to help in this COVID pandemic. If you have any questions, if you'd like to reach out, you can visit us at our webpage at openlmis.org or email us at info@openlmis.org. Thanks.
Thank you, Wes. Thank you so much. For me, this is a great example of how we can leverage an existing solution that many countries are using and adapt it in order to be able to respond quickly to COVID-19. And as we get prepared for the distribution of the COVID-19 vaccine in the next few months, I think it's really critical to leverage existing systems such as OpenLMIS. OpenLMIS is just one example in this case, but to make sure that we are efficient, quick, and that we're not adding an additional system, an additional new tool that the national counterpart had to learn. So this is, for me, a way to really capitalize on previous efforts to be efficient and quickly respond to, in this case, a pandemic. On this last note, thank you so much, Wes. It was a great pleasure. And thank you, everyone, for being there with us. And I hope you're enjoying the TechNet Virtual Conference. Have a good rest of your day, everyone. Bye now.